And in just about 3 hours from now, the president will take a major step in his effort to overhaul the healthcare system. He will get the ball rolling with a summit later this afternoon where hundreds will participate from many aspects of the healthcare industry. And among Americans, the president already finding a broad support. Look at some of the numbers out there. Quinnipiac poll shows 55% believe the president can reform the healthcare system and reduce costs for all of us. The results mirror a new NBC News Wall Street Journal poll that we discussed a lot yesterday. And joining us now is Republican Congressman Zach Wamp of Tennessee. He's a member of the House Appropriations Committee. Congressman Wamp, thank you so much for joining us. From what you've heard so far about some of the ideas coming from this new administration regarding health care, are you in support of it?
Well, it's probably the next major step towards socialism. I hate to sound so harsh, but this is another at least $1 trillion proposal. The president threw out $634 billion. I don't think that's really based on what it's going to cost. That's based on savings that he can cut from other programs like Medicare in order to pay for it. So the warning signs ought to go up everywhere. Here we go from $1 trillion bailout to $1 trillion stimulus to $1 trillion health care, $1 trillion cap and trade proposal. This literally is a fast march towards socialism where the government is bigger than the private sector in our country, and health care is the next major step. So we ought to all be worried about it. Mrs. Clinton tried to do this a number of years ago, and the country rejected it. So the devil is in the details. We're waiting for those details.
Congressman Watt, let me ask you this, then. This has been a big criticism of your party, that it is the party of no, but was the party of yes when the Bush administration was giving a bailout, for example, for Wall Street. So I'm going to ask you, what then is the alternative when you hear that 46 million Americans are without health care, that 1.5 will lose their homes as a result of health care expenses, and that this is not an issue of health care, it's affecting the economy? What is the Republican alternative?
Well, extending health care to the people that need it, not turning the whole health care system over to the government.
So how do you do that? How do you extend it?
Just because Republicans made a lot of mistakes doesn't mean it's okay for Democrats to make those same mistakes times 5 or times 10. That's literally what you're seeing here. Is this is not a Republican-Democrat thing. This is what is best for the country. And what you do to extend it is through the tax code, you give incentives for people to have health insurance. Listen, the 45 million people that don't have health insurance, about half of them choose not to have health insurance, and the employers are not providing the benefits. What the president is proposing now is to cut Medicare benefits for some people to help pay for this new expansion. So if you're on Medicare, beware. If you're a small business person, he proposes to take away your deductions for charitable contributions, for your mortgage deduction on your home in order to pay for health care. So if you're one of those people who choose not to have health insurance, maybe you will have health insurance, but if you're one of those people that currently have health care, maybe they're going to take a benefit from you to pay for getting it to the other people. So this is almost class warfare in order for him to be able to say everyone now has health care. Listen, health care is a privilege. I do think that in some populations...
Well, it's a privilege, health care? I mean, if you have cancer right now, do you see it as a privilege to get some treatment?
I was just about to finish to say that for some people it's a right, but for everyone, frankly, it's not necessarily a right. Some people choose not to pay.
What people is it a right for? Let's break down the category. Who is it not a right for to get health care?
An employee that rejects the health care provided by their employer because they don't want any of the money deducted from...
And what number of people do that? What do you base that on?
Half the people that are uninsured today choose to remain uninsured. Half of them don't have any choice, but half of them choose to what's called go naked and just take a risk of getting sick. They end up in the emergency room costing you and me a whole lot more money. How many illegal immigrants are in this country today getting our health care? Gobs of them. The problem with the Obama approach is health care for everybody. Who pays? According to his plan, people who are paying their taxes are going to lose their deductions on their homes. They're going to lose their deductions for charitable contributions. Right. He proposes to cut Medicare benefits from seniors to help pay for this. For who? For half these people.
Well, as you well know, sir, that the administration disputes that. But what we're going to do is let the president speak for himself. I am not speaking for him. I was just more intrigued by who has a right to have health care and who does not.
We better step up and defend our system or it's going to go away.
I think Americans think that we should have alternatives, certainly, and that's what they want to hear if they're out there. Thank you very much, Congressman. It's certainly great to talk to you.
You too.